Hello, and welcome to Patient-Physician Communication 1. My name is Sarah Bubenik. I'm a resident physician at UMKC, University of Missouri in Kansas City, and this class was designed for medical students and for MD and DOs with an assistant physician license in Missouri. That's me and my clinic. I used to live in Portland, Oregon, and I've since moved to Missouri. I'm beginning a psychiatric program at UMKC, and I've been working in primary care for the last 2 years. The importance of patient-doctor communication is evident here. A picture of me and my son. He was born with some medical problems, and not having good communication would have made this a very difficult experience for me. It's really important to communicate your skills well as a physician to the patient. And the reason being is because patients need empathy. Researchers have long examined and discussed the utility of empathy in medicine and have found a lot of results. Most of the time, being empathetic brings a lot of rewards to the patient-doctor encounter. So the course goals for this particular class is that students will learn foundational communication skills that they will continue to build on throughout their career. So we're going to develop basic interviewing skills, get an understanding of the importance of effective doctor-patient communication. The course objectives are related to knowledge and skill. So there's some separated out in for knowledge, and as medical students, you're expected to have very little knowledge, but as assistant physicians, you're expected to have a little bit more knowledge, and I'm just kind of gearing it to both camps. And we're going to be using the Google Classroom for a lot of our assignment postings and discussion groups. We're going to be using a learning-centered approach with a backward design to help students build competencies over time. And student-directed learning will be a big component. Now, this is a picture of bad doctor-patient communication. You can see that this lady has her arms folded. She's feeling very upset, and the doctor is not looking at her. And so, with our first class, we're going to be focusing on patient-centered interviewing. This is a good picture of a collaborative approach to patient-centered interviewing. The patient's views of his or her illness are the primary focus of patient-centered care. So you want to build a good interpersonal relationship, facilitate exchange of information, and include patients in decision-making. Here you can see patients feeling very frustrated, covering their eyes, not looking at the doctor. These are patients that are quote unquote difficult. And the big idea for this class is to articulate communication techniques to employ in specific difficult patient encounters and what factors contribute to those encounters. And here you can see a picture of somebody looking awkward in a conversation. So this is the class big idea for this particular class, will be identifying the type of conversations that are likely to be difficult for you as a provider. We all have patients that are difficult, and this relates to physician burnout and self-care, because if we do not take good care of ourselves, we cannot take good care of our patients. So one of the classes will be to understand the importance of self-care for yourself so that you can care for your patients. Another one of the classes will be based on intimate partner violence. We don't talk to people about partner violence, and one of the big class ideas is to identify components with empathetic screening for intimate partner violence. How do we know what to look for? Another one of the classes that we're going to be dealing with is breaking bad news. The class big idea here is identifying challenges that physicians face when breaking bad news to patients and generating strategies to cope with those challenges. And oftentimes people aren't geared appropriately for that. And then the last class in this 8-class series will be next steps in communication. So analyzing which communication skills come naturally to you and which ones you struggle with, identifying strategies for effective communication in brief patient encounters, and appraising the barriers to utilizing effective communication skills. The activities we're going to be utilizing are small group activities, role playing, and we're also going to be doing um, some some mock role playing where you evaluate yourself and write up kind of what you see from the video's perspective on your strengths and weaknesses. The benefits of effective communication. So, studies have shown correlations between a sense of control and the ability to tolerate pain, recovery from illness, decreased tumor growth, and daily functioning. It's very positive to have good communication skills with patients, and it leads down a path, perhaps winding or narrow and difficult to traverse for some people, but it does lead to a path and an open clearing. There is a fine balance to try to do patient care, get effective communication, and work within the boundaries of your institution. Possible improvements on doctor-patient communication should be to encourage patients to discuss their main concerns without interrupting them. Doctors interrupt patients about 8 seconds into the patient interview. So working on breaking down the barriers to effective patient communication is wise. And here's my son now. He is 5 years old and he's thriving. And that's because I know how to advocate for myself, and I know how to utilize good, effective communication as a patient and a physician. And this is kind of what I want physicians to help patients do, is advocate for their patients through effective communication.